started your timer, and here is your question. Right, so if you have read and understood, considering it clinical examination station, kindly begin.
I'll enter the room, I'll wash my hands, and then I'll introduce myself. Hello, I'm Dr. Karma, one of the exam candidates. May I confirm your name and age, please?
Yes, I'm 55 years old, Samantha.
Hello, Samantha. So today I have been asked to examine your hand, which will involve looking, feeling, and moving your hands. Is it okay with you?
Yes.
Thank you. So I'll make the patient sit, and I'll sit facing opposite to the patient, and then I'll ask for pillow, and then keep the patient's pillow on the hands. So now I'll look at your hands. I'll look on the palmar aspect of the hands. Look for any scar, any swelling.
Can you instruct the patient for exposure first, please, before you
expose? Yes, ma'am.
begin?
I'll expose. I'll ask the patient to roll her sleeve above the elbow.
Yes, good.
And expose the elbow.
Yes.
And then I'll start with inspection. I'll ask the patient
before
to show
that,
both
you'll confirm patient is not in pain. So you'll ask if you are in pain in any way before you'll begin your examination. Then, yes, please, now begin.
Okay, ma'am. So I'll ask the patient if you have any pain at the moment. Then if no pain, then I'll proceed. I'll inspect the hands on the palmar aspect and also dorsal aspect, and also ask the patient to show her elbows. Look for scar, swelling, any deformity, skin changes, muscle wasting, any nail changes. Now, I'm going to feel discomfort. Please let me know. I'll be as gentle as possible. I'll look for temperature with the dorsum of the hands on both sides. Then I'll feel the radial and ulnar, both the radial and ulnar pulses on both hands. Then I'll see for tenderness and palpate the thinner and hypothinner muscles. Then I'll do the bimanual palpation of the wrist, metatarsal heads, and then the interphalangeal joints and the anatomical snuff box. And then I'll palpate the ulnar border of the forearm from the wrist to the elbow to see for any rheumatoid nodules. Now, Samantha, I'm going to I need you to do certain movements of your hands. So I'll ask her to make I'll do active movement first. Ask her to make a fist, and then ask her to splay her fingers. Then I'll ask her to bring her palms together, and then raise her elbow to see the extension, and then put the dorsum of the hands together, and then put the dorsum of the hands together to see the flexion, and then I will ask her to extend the fingers against resistance on both the side, and then I'll ask her to splay her fingers and don't let me push inside. See the adduction of the fingers. Then I'll see for the thumb. I'll ask her to put her hands facing the palm facing upward, and then push her thumb above and avoid me from pushing it down to see the abduction of the thumb. Then I'll test the flexor digitorum profundus and superficialis individually by for the distal interphalangeal joint. I'll fix the proximal interphalangeal joint and ask her to flex. Then I'll ask her to do the same for the proximal interphalangeal joint. Now Samantha, I need you to do some special test. I'll ask her to hold my fingers in her hand to see the power grip. Then I'll ask her to hold my finger in between thumb and the index to see the pincer grip, and then the precision grip. I'll give a coin or any small object, and I'll ask her to pick with her thumb and index finger on both the hands. Now, Samantha, I need you to bring your hands by placing the dorsum of the hands together to do the phalanx test, and keep it there for 60 seconds. And then I'm going to tap on your wrist on the anterior aspect. I'll tap on both the wrists to test the Tinel's sign, and ask her if she feels any tingling sensation or not. Then I'll also do the Fromets test by giving her a paper and asking her to hold the paper and not let me pull between the thumb and the index. Then Samantha, now I'm going to do some sensory test. I'll ask her if she can feel the. I'll take the cotton and ask her if she can feel that. I'll make her feel on her chest upper part. If she can feel, then I'll ask her to close her eyes, and then I'll test on the dermatomes on the median, on the median nerve, ulnar nerve, and for the median nerve, I'll test on the thinner eminence on the for the ulnar nerve on the hypothenor, and for the radial nerve, I'll test on the first wave space on the dorsal surface.
Can you present your case now? Your examination.
To complete my examination, I'd like to examine the elbow joint and also do a full neurovascular examination of both the upper limbs. So today I've done the hand examination of Miss Samantha, 55 years old female, and on inspection there was no abnormality, but on palpation and other special tests, I found that she had a positive phalanx test and Tinel sign, and the rest of the examination findings were normal.
What were your motor examination results?
On motor examination, I found that there was weakness on the weakness of the muscles that was innervated by median nerve.
Yes.
Like the abduction of the thumb.
What was the sensory deficit? Where was it present?
For sensory, there was decreased sensation, paresthesia on the distribution of the median nerve.
Okay, radial 1.5. Okay, how would you confirm your diagnosis? What investigations would you ask for this patient?
According to my examination, I am considering it to be carpal tunnel syndrome.
Okay.
So I would like to confirm my diagnosis with the electrophysiological studies like electromyography or nerve conduction test, and I'll also do an MRI scan of the wrist to see the carpal tunnel or find out other causes, and also do some blood investigation to check blood sugar and also thyroid function test to rule out the etiology.
Good. What treatment alternatives can you offer to this patient?
First of all, if I find out the underlying conditions, I'll treat that, and then if no, then I'll begin with conservative management. First, I will give her analgesics, then splinting of the wrist at night. Then if that doesn't help, then I'll go for steroid injection,
Yes.
intralesional, and and then if that doesn't help, conservative treatment doesn't help, then I'll go for surgical options where I do the carpal tunnel release now.
Good. Okay. Right. Now the feedback part. Well, we'll go in a second. Yes. All right. Okay. It was good. Very good examination, but there are certain things that I thought you just went quickly over them and you didn't do. The palpation thing. Like when you were inspecting everything, the posters, the color, skin changes, everything, then there was even the deformities. Then you had to you had to feel the arm, forearm, even the joints, even the first dorsal space for the radial nerve. And then you had to bimanually palpate all the joints. And then you had to palpate the anatomical snuff box if there was any tenderness. And then you had to also bipalpate patients' the wrists of both sides. And then you had to even palpate the elbow along the border, ulnar border, because if you were expecting it to be rheumatoid carpal tunnel syndrome, so there must have been some rheumatoid nodules or along the extensor surface, or right. So yeah. Other than this, I think you covered even the inspection. You covered even the examination. It was just the palpation part. I think you just went quickly over it. Correct me, please, because this is what I was noticing. Because examination, you were doing it everything. You were adducting, abducting. You were like kind of completing it everything. Even you were doing the special test, and you even told me the test to complete your examination. So it's good. It's just the palpation thing I think you have missed. Thank you.
The palpation part, the temperature, tenderness,
Yes.
then the bimanual palpation, the ulnar border palpation, all I mentioned. But
Okay.
Regarding I had one question here. Like temperature, we'll check. Okay, for tenderness, like other than the bimanual palpation, where exactly we test for tenderness, ma'am? We test with the bimanual palpation.
Yeah, first, and then you'll confirm it with the special test, kanalen.
Okay.
Yes.
And I missed the passive movement.
Passive movements, but you did mention that you'll begin your examination with the active movements first. So once you say that, then
Yes.
other person thinks, okay, if he's mentioning active movements, then definitely he knows about the passive movements. And then you have to carry out the examination on both sides, both hands. Then one thing definitely you missed was the bimanual palpation or palpation of the anatomical snuff box.
This I mentioned, ma'am.
Okay. I thought you missed. All right.
I'm regarding the thumb. We can just do the active movement of the thumb, and for the motor, we can just test the abduction. No, ma'am.
Yes.
I hope that won't be an issue.
Shouldn't be. Yes. Someone is asking.
Thank you, ma'am.
Of course you will.